So good morning, good afternoon and a good evening all. A very warm welcome on behalf of the IAPB events team. We're very much looking forward to supporting you with today's UN Friends of Vision side event for the 66th Commission on the Status of Women. How can iHealth contribute to achieving gender equity and the empowerment of all women and girls in the context of climate change? I'm now delighted to hand over to Jennifer to welcome you to the webinar. Thank you very much.
Thank you, Claire. And welcome everyone to the UN Friends of Vision official side event of the 66th Commission for the Status of Women. My name is Jennifer Gersbach and I am the co-chair of the International Agency for the Prevention of Blindness Gender Equity Work Group and also the Executive Director of Global Advocacy at the Fred Hollows Foundation. Today we're asking the question, how can iHealth contribute to achieving gender equity and the empowerment of all women and girls in the context of climate change? The fact is, vision impairment is a gender issue. Data shows that women and girls are more likely to be blind or vision impaired than men or boys. And we mustn't forget that behind every statistic is the life story of an individual woman or girl. Climate change has a particular urgency due to the universal failure to make any meaningful progress towards addressing the climate crisis. Importantly, women and girls are being recognised as more vulnerable to climate-related disasters than men, and their vulnerability is the result of numerous socioeconomic factors such as limited access to education and health services, dependence on natural resources, and a lack of formal employment and social protections. Underlying and exacerbating each of these barriers is poor eye health, a public health problem distinctively plagued by gender inequality and a significant threat to sustainable development. 2021 was a pivotal year for eye health with the unanimous adoption of the UN resolution Vision for Everyone, accelerating action to achieve the Sustainable Development Goals, as well as the publication of the Lancet Commission on Global Eye Health. The Lancet report states, planetary health is a key component to improving the quality of eye care and making women and girls less vulnerable. Moreover, environmentally sustainable eye health services are required if we are to make progress towards achieving the Sustainable Development Goals. The UN Friends of Vision Group believes the window for achieving our climate goals and removing barriers to gender equality is rapidly closing, leaving future generations of women and girls at disproportionate risk. This is an unmissable opportunity to make eye health integral to global recovery and sustainability and help shape a more just and equitable world. This event has been made possible through the leadership of the UN Friends of Vision Group. Today, we are joined by His Excellency Ambassador Webson, Permanent Representative of the Mission of Antigua and Barbuda. Also, Her Excellency Ambassador Fatima, Permanent Representative of the Mission of Bangladesh, and Her Excellency Ambassador Bern Nassen, Permanent Representative of the Mission of Ireland. We are also delighted to be joined by Her Royal Highness the Countess of Wessex, an IAPB Global Ambassador, who will be closing our session today, and are honoured by the support of UN Women and the World Health Organization, who are both co-sponsoring this official CSW side event. Now I would like to introduce His Excellency Ambassador Webson, the Permanent Representative of Antigua and Barbuda to the United Nations and founding co-chair of the UN Friends of Vision Group. Ambassador Webson, you have the floor.
Oh, Ambassador Webson, you're just on mute at the moment. Ambassador Webson, you're just on mute at the moment. If you could just unmute yourself.
Can you hear me now?
I can. Perfect. Thank you, Ambassador Webson.
Okay. Thank you very much, Jennifer. I gather I was muted for the introduction. good morning, and good day, and to some, good evening. I know that, Natasha, I think it's almost midnight, and we thank you. I want to say how wonderful it is to be in the company again of my dear friends, Ambassador Fatima Robert. Wonderful to have you back, and Ambassador Geraldine Bern Mason. How wonderful, Geraldine, it's been too long. Wonderful to be here, and happy St. Patrick's Day and this wonderful morning. Friends, colleagues, excellencies, thank you for joining us for this important United Nations Friends of Vision event, our first official CSW event. As I was sort of preparing for today, it occurred to me that the phrase in the context of climate change has become quite common, quite normal, and that bothered me. As some of you know, I am the current chair of the Alliance of Small Island States, AOSIS, and as such, I have been intimately involved in the recent climate change negotiations and discussions, those that took place recently in Scotland, and ongoing discussions as we are leading up to the next COP later this year. The world is still far off track from its stated goal of keeping global temperatures from rising to above 1.5 degrees Celsius. Based on current pledges and commitments through NDCs, we are on track for now for a warming of about 2.5 degrees, which I'm sure you've heard would be catastrophic for small island states, and particularly for countries like mine, Antigua and Barbuda, and for low-lying coastal states. And many of the world's most vulnerable people live in these states, and particularly women and girls. Today, in this webinar, you will learn more about the interaction between climate change, eye health, and gender equity. While the climate crisis grows, we also know that global blindness will likely to triple by 2050. And the evidence shows that women and girls are more likely to develop vision impairment and less likely to receive treatment. This is particularly the case in low and middle income countries, where 90% of vision loss occurs, and which already are or will struggle to adapt to the changing climate that we are facing and experiencing. But despite these many challenges, the picture is not always gloomy. It's not always gloom and doom. We know that the solution exists for stopping climate change, helping people see, and improving gender equity. The solutions are here. They are here now. We just have to apply them. Like the SDGs, they are interrelated, and progress on one depends on addressing the others. Events like today's especially, and fills me with hope. I am encouraged. All of us should be encouraged. And I encourage all of us in these discussions and in our work to not only focus on the challenges, but also the opportunities and the solutions. The solutions are with us. They are in our hands. Let's focus on concrete solutions which we can take forward together. And in doing so, improve people's lives and change the circumstances of those who needlessly fall to the prey of eye health. We can do it together. I thank you.
Thank you for those opening remarks, Ambassador. You have set the scene for today's discussion. I would now like to introduce Her Excellency Ambassador Fatima, the Permanent Representative of Bangladesh to the United Nations and co-chair of the UN Friends of Vision Group. Ambassador Fatima, you have the floor.
Thank you. Thank you very much. Her Royal Highness, the Countess of Wessex, distinguished co-chairs, excellencies, distinguished colleagues and friends. It is my honor and privilege to welcome Her Royal Highness, the Countess of Wessex, and all our distinguished panelists and guests to today's event, organized by the Friends of Vision on the sidelines of the Commission on the Status of Women. This year's Commission on the Status of Women, as you had rightly mentioned at the outset, Madam Moderator, takes place following a landmark year for eye health, which saw significant strides in recognizing the vital role vision plays in global development. On the 23rd of July last year, the UN General Assembly, led by the Friends of Vision, adopted the first ever resolution on vision health entitled Vision for Everyone, Accelerating Action to Achieve the Sustainable Development Goals. That was a clear manifestation of the international community's commitment to eye health for the 1.1 billion people living with preventable sight loss by the year 2030. The resolution is the first of its kind to address preventable sight loss, recognizing eye health as part of the SDGs. It specifically draws attention to the disproportionate prevalence of vision impairment for women and stresses the need to achieve gender equality in eye health and access to eye care in order to ensure progress on SDG 5. Excellencies, distinguished colleagues, climate change is disproportionately impacting the lower and middle income countries who bear the brunt of its impact despite being the least responsible. The sad irony is that 90% of the people with vision impairment are living in these countries where there is limited to no access to vision care. And as we all know, women and girls are especially vulnerable to the adverse impacts of climate change and thereby also to vision impairment. Excellencies, this year's CSW theme of gender equality and empowerment in the context of climate change aligns with our efforts to address avoidable vision loss for a healthier, safer, and more equitable world. It is imperative that we do not lose the momentum generated by the Vision Resolution. It has created an opportunity to show leadership and scale up efforts at every level, global, regional, and national, by all stakeholders in fulfilling the global commitment to leave no one behind. It can serve as a critical tool for women's empowerment, development, and prosperity as well. The Friends of Vision Group will continue its effort to advance the resolution's objectives, to build consensus, and encourage further actions towards that end. We will count on all stakeholders, especially the excellent partners that we have in the civil society organizations, to do so. And today's event is an auspicious start to our endeavors for the year, made more so special with the kind presence of Her Royal Highness, the Countess of Wessex. I thank you.
Thank you, Ambassador. Powerful words, and thank you also for your strong support for the UN resolution and its implementation. And now I would like to introduce Her Excellency Ambassador Bern Nason, the Permanent Representative of Ireland to the United Nations and co-chair of the UN Friends of Vision Group. Ambassador, you have the floor.
Good morning. Thank you very much, Jennifer. Good morning from a sunny New York to everyone. And I also want to wish a very warm welcome to Her Royal Highness. It's also a generous reflection of your advocacy for this important event that you're with us so early here in New York. So thank you for that. Jennifer, you said it at the beginning of our conversation this morning that women and girls are more vulnerable to climate disasters than men. The fact is that we know that 80% of people who are displaced by climate change are women. And a recent study has shown that 141 countries where there have been disasters in those countries, more women than men are killed in the context of those disasters. More of them are killed at an earlier age. And that is particularly true in poor and vulnerable communities. We also know that women and their vulnerability can be the result of numerous socioeconomic factors, such as access to education, health services, their dependence on natural resources, and often a lack of formal employment and social protection. Underlying and exacerbating each of these very important barriers is poor eye health, a public health problem exacerbated by gender inequality, and it is a significant threat, as we've heard, to sustainable development. I believe it's unacceptable that preventable vision impairment for women and girls is allowed to heighten their vulnerability and put their lives at disproportional risk. So obviously also increasing in a volatile environment. More than half, so 55% of people with vision loss are women and girls. The real tragedy is that 4 out of 5 of those women and girls shouldn't be blind. They don't need to be blind, as their most common eye conditions, cataracts and refractive errors, can be easily prevented and treated. So we simply must ensure that our eye health programs and interventions are gender responsive, and that the female eye health workforce is properly supported internationally, appropriately resourced, and importantly, very importantly, that women are included in policy discussions and decision making. I will admit to you, both professionally and personally, that Ireland's work with the group of Friends of Vision has been an absolute highlight for me during my tenure as Ireland's ambassador here in New York. And while in some ways we reached a very high watermark, a pinnacle last year with the agreement on the resolution, I believe the real work, which is the implementation of that resolution, is only just beginning. Today's discussion, so welcome, is an important step in breaking the issue of vision out of a health silo and showing that improving eye health can impact positively on the empowerment of women and girls right across our society and across the range of big international policy issues that we're grappling with here every day in New York. It will help us to better understand how progress on other aspects of the 2030 agenda, economic, social, environmental, can support our goal, our common goal here today, of improving eye health and addressing preventable sight loss. I want to thank you all for being with us this morning, and to say once again that we fully support this really noble and urgent agenda. Thank you.
Thank you, Ambassador. Really powerful points that you make, and I agree totally that the hard work is ahead of us with the implementation of the resolution, but I'm sure that we can achieve that. Thank you all ambassadors, for our 3 co-chairs, really strong opening remarks. I would now like to introduce Ms. Åsa Regner, Assistant Secretary General of the United Nations and Deputy Executive of UN Women. As mentioned, we are delighted that UN Women have co-sponsored this event. Now let's hear from Åsa.
Excellencies, delegates and colleagues. Vision is closely connected to the achievement of the SDGs. The goals are very much interlinked and require coordinated efforts among various actors and sectors. We know that the health of women and girls is threatened by climate and environmental crises and disasters. When it comes to eye health, climate change increases ultraviolet radiation, air pollution, and dry conditions, all of which affect the eyes, which are directly exposed to the environment. 55% of the world's visually impaired are women, and 80% of people displaced by climate change are also women. Women are 8% more likely to be blind than men, and 15% more likely to have moderate to severe vision impairment. However, with access to eye care, up to 80% of these impairments could have been easily prevented or treated. Sadly, women in many countries continue to face significant barriers to accessing healthcare and to realizing their rights to health. Addressing inequalities and removing gender-related barriers to services will advance eye health. It's no surprise that women and girls who bear the highest burden of eye health conditions are the same who are disproportionately impacted by climate change. While women face compounded barriers to eye care, they are frequently left out of decision-making related to universal health coverage and climate change. As we move forward on achieving gender equality and the empowerment of all women and girls in the context of climate change, it is essential to recognize that women play a vital role in developing solutions to improving eye health. Through women's experiences as first responders in crisis, entrepreneurs of green energy, caregivers, and community mobilizers, women offer valuable insights into better managing the climate and its risks. We must harness this knowledge and expertise to put gender equality at the center of solutions to address climate change and environmental crises, and thus to reduce risk during disasters. Thank you very much.
And thank you, Åsa, for those remarks, which make a really clear connection between eye health, gender equity, and climate change. And finally, last but not least, I would like to introduce our second co-sponsor today, representing the World Health Organization in his capacity as Director of the WHO Office at UN Headquarters in New York. Please welcome Mr. Werner Obermeier. Werner, you have the floor.
Thank you, Jennifer, and good morning, everyone. It's really an honor for us to be co-sponsoring this event with the Friends of Vision and IAPB this morning. And I'm delighted personally to be in such esteemed company today. The WHO welcomes the attention to linking eye health, climate action, and empowerment of women and girls. It's very timely to have this discussion because we know that climate change threatens eye health, and the number of women with vision impairment globally outnumber men by up to 10%. Extreme weather events such as hurricanes and floods, wildfires across the world have already led to temporary closures and destruction of medical facilities and supply chains of critical medical equipment, including medications, surgical supplies, glasses, and assistive devices. Disruption to critical eye health services will further exacerbate already strained health systems and the eye care health workforce. Countries with inadequate and unprepared health infrastructure will obviously be the least able to cope. Exposure to indoor air pollutants caused by cooking and heating with harmful biomass, kerosene, fuels, and coal leads to eye problems. And there is evidence that these pollutants disproportionately affect women and girls, as they are responsible for family care and household work in most parts of the world. It's estimated that 4.2 million deaths every year occur as a result of exposure to ambient or outdoor air pollution, and a further 3.8 million deaths occur as a result of household exposure to smoke from dirty cook stoves and fuels. In fact, 9 out of 10 people worldwide live in places where air quality exceeds the WHO guidelines. This is especially concerning for women in low and middle income countries, with evidence suggesting consistently that women are significantly less likely to undergo cataract surgery than men. Women in these settings have also been shown to be more susceptible to some eye conditions such as trachoma due to greater contact with children in their role of primary caretaker. Climate change alters the epidemiology of vector-borne diseases and the spread of neglected tropical diseases in particular, including trachoma and river blindness, which are infections that affect the most poor and in rural areas of the world. Due to widespread use of insecticides for vector control, antimicrobial and insecticide resistance are emerging threats in the control and the spread of these diseases. To address challenges of climate change, we need more investment in climate change strategies that would enhance the resilience of health systems against the threats brought about by deforestation, massive forest fires, and sand and dust storms, which move across oceans and these all affect our health detrimentally and impact on safeguarding vision for people everywhere. The priority over the coming decade must be to build climate-resilient health systems and tracking national progress in protecting health from climate change, with a special emphasis on gender equity in the use of eye care services. Thank you again for inviting WHO to this important event.
Thank you, Werner, and also Åsa and ambassadors for setting the scene so well. We now will move to our panel discussion. So addressing the unique health and socioeconomic needs of women and girls in the context of climate change has the potential to transform unequal power relations and help end gender-specific vulnerabilities. We know that women and girls are powerful forces for change when given the opportunity. Women's voices, knowledge, and recommendations are often missing. Action is needed to promote and support the progression of women to obtain eye health leadership positions and to take their place at the decision-making table. So let's explore this further with our panel of experts. It's my pleasure to introduce our panelists today. First up, Samrana Yasmin. As a professional in international development, particularly in eye health and social inclusion, Samrana has been working with various non-profit organisations in different capacities to support and manage programs globally. Samrana is the Senior Global Technical Lead for Refractive Error at Sightsavers and a member of IAPB work groups for gender equity, refractive error, and school eye health. Next up, we have Natasha Yu. Natasha is a public health expert with over 16 years experience in public health eye care, international development, and clinical optometry. Natasha works at the World Health Organization in the Vision and Eye Care program. She is also co-chair of IAPB's Climate Action Work Group. Next, we have Rachel Stancliffe. Rachel began her studies on systems thinking and population health with the aim to work across disciplines on complex problems. For the past 14 years, Rachel has been working on the intersection of health and the environment and founded the Centre for Sustainable Healthcare in 2008, an organisation that supports the transformation of healthcare in the UK and internationally for a sustainable future. And our last panellist is Lara Partridge. Lara is the global head of talent at Santan, one of the leading ophthalmic companies worldwide, where she leads a team of specialists with a focus on social innovation and vision equity. Passionate about eye health and sustainable philanthropy, Lara contributed to multiple projects during her time with Standard Chartered through the bank's Seeing is Believing partnership with IAPB. So welcome all of you and thank you for joining us today. So my first question is to you, Samrana. The 2015 Paris Agreement calls for gender equality and women's empowerment, and its provisions on adaptation and capacity building efforts urge member states to adopt gender-responsive approaches. Tell us, how do you see gender equity in eye health supporting the broader UN agenda?
Thanks, Jennifer. Hello, everyone from Islamabad, Pakistan. Jennifer, Paris Agreement recognizes that there are social, economic, and environmental dimensions of climate change. It also acknowledges the fact that unless women's needs and contributions are considered, we won't be able to achieve the true sense of sustainable development. We know that across communities, the impact of climate change affects women and men differently. And the situation is not very different when it comes to eye health. Women account for 55% of people with visual impairment, but have less access to care. And the projection suggests that this will continue to increase if we didn't address this pressing global issue. We all know by now that good eye health and vision are critical for many aspects of life, including health, education, and economic productivity. Leaving no one behind is the central promise of 2030 agenda. And it won't be possible if women and girls do not have access to eye health services and products. Ensuring gender responsiveness of our eye health intervention improve people's life. It improves their learning outcomes, health outcomes. It also makes sure that their employment opportunities are enhanced. So yes, gender equity in eye health will support the broader UN agenda because it will lead to more productive societies, support progress towards universal health coverage, quality education for all, and most importantly, is going to help us combat climate change and its impacts.
Thanks, Ramona. All powerful arguments there. If I may follow up with one more question. Women make up 70% of the healthcare workforce, yet men hold 75% of the leadership roles in that same workforce, leaving women clustered into these lower status, low paid, and often unpaid roles. What are some tangible changes that we can make in this space? And does what is happening around us with the climate crisis influence the urgency?
Absolutely. There is no denying that women empowerment and advancing gender equity deliver results. We already determined the fact that climate change and eye health are linked in a cause and effect cycle. It is important for us to recognize the contribution of women, not only as key stakeholders, decision makers, educators, and experts, but making sure that it's been acknowledged at all levels. Women needs to be part of these conversations and decision-making processes, not just at the global level, but at the national and community levels as well, because that's where the real change needs to happen. Promoting gender equity in everything what we do is going to make sure that we lead towards tangible, long-term, sustained impact and realize a very equal, just world for everyone.
Sounds beautiful. I hope we're on that pathway. Okay, Natasha, I'll move you. Thanks, Imrana. Natasha, if I may ask you a question. Access to eye health and in turn accessible, inclusive education systems promotes upward socioeconomic mobility for women and girls and can empower them to pursue careers in the science fields. Despite growing recognition of the unique experience and skills women and men bring to various professions, gender inequity is pervasive in medical science, and eye health research is no exception. Why do you think that might be?
Thanks, Jennifer. Firstly, I just want to say that I'm privileged to be part of a panel with such incredible women working in the field. As your question suggests, Jennifer, there is a persistent and wide gap between the genders across the board, whether we're talking about representation, the gender pay gap, promotions, all the way through to the number of research papers published over the course of one's career where men come out in front. Now, why is this the case? There's no single one answer here, and it's quite complex and interconnected. The evidence points to a number of possible explanations, including difference in family responsibilities, career absences, role stereotypes on what women can be doing and should be doing, and patriarchal attitudes and the general lack of support for women pursuing careers in science. While there is an awareness of problem and there has been progress in the recent years, I think we can all agree that the progress has been too slow, particularly for women of colour. And I'm hopeful that in my generation, we can dismantle biases that prevent women from pursuing and thriving in science. And to make that happen, though, I think it's going to require all of our combined efforts. Thank you.
Thanks, Natasha. Yes, well, I do feel that at least we're now starting to talk about that bias, whereas a few years ago, it was behind closed doors. So that has to be a step in the right direction. Much more to do. I may follow up with one more question, though. The Lancet report predicts that the number of people living with untreated vision impairment will grow to 1.8 billion by 2050. Evidence shows that women and girls are more likely to develop vision impairment and less likely to get treatment, which we've heard a few times today. Currently, 55% of people with vision loss are women and girls, and 90% of untreated vision loss is in low and middle income countries. It's clear that climate change is contributing to these increasing numbers. What are some of the challenges or barriers to embedding environmental sustainability within the global eye health sector?
Thanks, Jennifer. I think there's two challenges that I'd like to quickly highlight. The first one is there's the perceptions around cost. Many organizations and ministries believe that climate change solutions need to be high-tech, expensive, and require complete overhaul of the business. But there really are many simple, low-cost solutions that over time can make a huge impact. In fact, many of these climate change interventions can actually reduce costs and save us money. An example of this would be to reduce unnecessary single-use consumables during a clinical exam, where the reusable options with the correct cleaning regime are just as safe, much cheaper in the long run, and better for the environment. Secondly, I think many of us work in the eye health sector are still in that awareness phase rather than the taking action phase. Even though the topic of climate change has been around for decades, it's always been thought of as an environmental issue, not our issue. But now with its connection with health, and specifically eye health, which has come into mainstream thinking in the last 5 years, I think we can really see some change. And events such as this is accelerating the awareness phase so that we can take those next steps. And if I can quickly put a plug in for the work of the Climate Action Working Group at IAPB, last year we launched the call to action and guidelines that help individuals, organizations make practical steps for their workplace through 10 key areas of action. And the key action area of leading, we acknowledge that if we want to build a sustainable future, we need the participation of girls and women. And that's an area of the work that the Climate Action Working Group want to explore and develop further going forward. Thanks.
Thanks, Natasha. And it's great that you're co-chairing that work group. And I think it's a demonstration of movement from awareness to action when the Climate Change work group changed its name to Climate Action Work Group. So that's a step forward as well. Okay, now if we move to you, Rachel, deep-rooted gender inequity means that despite the incredible resilience and capacity for survival that women exhibit, the resulting vulnerabilities put their overall health and survival at greater risk. What are some of the strategies to promote equity and fairness for the most vulnerable populations and regions that we should be promoting?
Thank you very much, Jennifer, and hello everybody from a slightly rainy Oxford, as you might expect in the UK. So I suppose the obvious answers, I mean, lots of people have said lots of things already. Obvious answers are the wider determinants of health, so education, access to family planning, flexible training and working patterns which allow women to maintain employment while looking after their children and offer proper living wages. In some regions, obviously, we'd add access to land rights and financial credit. So we need to recognise the critical role that women can play in contributing to solutions for a healthy environment, which is vital for everybody's health. Fundamentally, I think one of the things is to listen to women in different contexts, listen properly and find out what they need. One of the biggest problems is lack of voice, so helping them to be heard at every level is a really important background principle. So, you know, I don't know if you know Kinari Webb, who spent a lot of time listening before she started Health in Harmony, which now empowers women within communities to take action. Gender responsive policy measures can help obviously overcome systemic barriers within the health system and other parts of society. And you know, we know a lot about the underlying reasons why women don't have equitable access. Some of the things that we can do about that are, you know, obviously the background ones we've mentioned on education. We can have quotas in terms of access at different leadership levels. We can have ensure that climate finance is equitable. And of course, women and children are already leading their own solutions to the interlinked challenges of climate change and gender inequality. And to scale these up, they need access to climate finance in a lot of cases. So small innovations can transform that access for women's organizations or individuals in many areas. And we can have you know, direct access channels that remove governments and middlemen and so on. And I think the kind of plethora of different types of organizations which are coming up and which are entering this area are really exciting, because they do offer much more openness and freedom to women. I don't know how many of you were at COP26, but civil society groups there were celebrating women's climate leadership. We have the Gender Just Climate Solutions Awards, which included a lot of wonderful examples of things that women are doing in this area, both farming and energy and lots of different fantastic solutions. And those initiatives prove that combined solutions to climate change and gender inequality exist. Women leaders, new and emerging, just need more support. So as we know with eye health, there are some underlying principles. I think was mentioned at the beginning is prevention. And obviously prevention is the best form of treatment in terms of healthcare. And this is critical for the climate crisis too. So along with equality and equity of access and so on, we need some focus on a couple of, I think, simple and underlying principles which are key, such as prevention and leadership, which will help us to do this important thing of bringing gender equality and climate change solutions together. Because fundamentally, we all know that they are totally interlinked and that we need to tackle both together. But it's how we make that happen is obviously difficult on the ground. And I really like the idea as well of pushing the fact that these are not more expensive. They are probably going to save us money. And so we go for these win-win solutions, which hit both climate change, gender equality, and cost reduction, which is what we refer to as the triple bottom line, and can help us to look at the SDGs in a really positive way and not see these as difficult things, but actually a very positive way to go forward. That's probably enough for me.
Thanks, Rachel. You made a lot of excellent points there, but I really like the point you made about women being properly listened to. I think that small change could make a difference as we move forward. Now, Lara, if I could turn to you, can I ask you, how easy or difficult is it for the private sector to play a role in supporting the changes that need to be made?
Thanks, Jennifer, and good evening, everyone, from a very dark evening in Singapore. And it's a real privilege to be a part of the panel with such an incredible group of specialists. With regard to the role that the private sector can play, historically, it's been really hard for organisations to work on these issues in the interconnected way that we're talking about them today, simply because of the way we structure organisations. For the longest time, we have designed whole companies around delivering commercial outcomes. And so when we think about modern day ESG issues, we don't have a square hole for a square peg. And so typically we split these issues up. And so when we're working on the moral imperative to tackle inequality, organisations typically look at that through the lens of DE&I, and we sit the responsibilities over here with our HR team. But then we look at the scale and the urgency of climate change, we have to go to a completely different part of our business in another corner, working via groups like supply chain or procurement. Or we fracture the issue even further, and we divide up on geographic lines, and we send little bits of accountability out to the four corners of the world. So what this means is that the groups of people within organisations working on gender or working on environment are rarely, or if ever, in the same physical or virtual room. But this presents opportunities for the future. We can make choices to partner better. We can work together to spot opportunities, and we can make the conscious choice to bring these issues back together and make them whole, so we can have that multiplier effect where it's needed most.
That's really insightful, Lara. Can I just follow up with a quick question? What action has Santan taken to date, and where does climate change and gender equity sit within your organisational priorities?
Well, let me answer the last part of your question first and say that climate and gender are top priorities for all our stakeholders and considered critical by the talented team members we have in our company today. But also, I think for the sector, are important to the talent that we want to attract to come and work with us on vision in the future. So in terms of what we've been doing as a company 2 years ago, we made the decision to reframe the contribution that we can make through the lens of social innovation. And because social innovation requires us to seek new solutions to old problems, we've created whole new groups within our business looking at therapies and new digital solutions to come up with solutions for eye health issues that don't have answers or solutions today. And we are supporting research into new innovations, like looking at sustainable impact guarantees and seeing what kind of benefit that could have for our industry sector. And then lastly, as a company, we talk a lot about leveraging external strengths and turning diversity into advantage. So honouring the spirit of SDG 17, we consciously choose partnerships with the IAPB or with the Gender Equity Working Group, because we know that we will go further and we'll achieve more if we add our efforts and strengths to the efforts and strengths of others.
Trying to get myself off mute then for a moment. Thanks, Lara. Yeah, it sounds like your company is being very intentional, which I think is what we all have to be if we're going to take action and make a difference in this space. We are now ready to go to the Q&A session. I understand that we do have a request for a statement by the councillor at the Mission of Japan, Dr. Kita. Is that correct? Dr. Kita, if you are there, you can have the floor. I'm just looking for some technical advice here.
Yeah, we've just allowed Kita to allow to talk, so hopefully if he can, he
hello,
should be able to.
Hello, can you hear me?
Yes, we can hear you.
Thank you very much for the floor, and I would like to appreciate the Friends of Vision Groups, co-chairs, ambassadors of Antigua and Barbuda, and Bangladesh and Ireland, and also for the colleagues of IAPB. And also, I would like to appreciate for the floor for me. My name is Yosuke Kita, the Counselor of Permanent Mission of Japan. So for the eye health in Japan, we are leading the UHG Friends Group. So we are supposed to have the UHG high-level meeting next year, 2023. As you may know that at 2019, we have some text for eye health in UHC political declaration in 2019. So eye health is really important in the context of UHC because in some countries, also in Japan, the leading causative diseases of visual impairment is glaucoma and retinitis pigmentosa and diabetic retinopathy. For that context, regular checkup for eye health is really, really important. So we can easily assume that the socioeconomic status could have a great impact for their eye health impairment, especially for the vulnerability for women and girls. So as for the 2023 high-level meetings, we are supposed to revise the political declaration for UHC. So I would like to do my best to promote the eye health in the context of UHC political declaration next year. And we would like to contribute the promotion of eye health. Thank you very much.
Thank you, Dr. Kita. That is just wonderful news to hear that. And universal health coverage, of course, cannot be achieved without eye care being addressed. So we really welcome that support from Japan. Thank you so much. Now, I do believe we do have a question that was posted for the panel. And so I will put the question out there, panelists, and you can choose who answers. The question is, many of these barriers are rooted in deep cultural beliefs and traditions. What are thoughts about bringing men at a local level into the dialogue? So perhaps Samrana, you might be able to, I don't want to pick on someone, but perhaps I will pick on you. Perhaps you could start by making a comment on that.
No, absolutely. Thanks, Jennifer. I completely agree. In many contexts, until and unless men within the communities are on board to make sure that women are supported to voice their concerns, their recommendations, their suggestions to make necessary changes, we won't be able to go further. So it's really important to identify the right allies within the communities, within the government and other sectors to make sure that they are champion for this cause. Because yeah, until and unless they are on board and they are agent of change, we won't be able to achieve what we are aiming to do in context of gender equity. How we manage to bring them on board can be very context specific. It'll be different when it comes to Pakistan to how things can be done and influenced in Africa. So keeping an eye on how a community interacts within their framework and finding those touch points where we can influence and bring that positive change is the key.
Yeah, well said. Well said, Samrana. I think that local context is so important because we do have to be able to respond within that local context and take into account all of the different cultural beliefs and traditions and so forth. But yes, excellent point. I think in the interest of time, we may have actually run out of time with our Q&A. This always happens. There's never enough time to get a lot of questions going, but I would like to thank all of you. You've been outstanding panelists. So thank you, Samrana, Natasha, Rachel and Lara. I think today has been the first time that I've witnessed such a deep discussion that examines the intersection between eye health, gender, and the climate crisis. So I'm going to very briefly try to summarise some of the points, I guess, that came out, or at least the main takeaways that I've picked up from this panel discussion today. And I guess looking at eye health as a development issue, the sector really must take a greater intersectional approach, one that acknowledges the concrete experiences of inequity and the layers of disadvantage that affect access to services as well as opportunities to engage, as we heard from all the panelists. And clearly this is not a women's only issue. It is everybody's issue, and we must bring men and boys along with us on this journey to work together to address gender inequity in all its shapes and forms. In my opinion, collective action is the way forward. In fact, it's the only way forward. Only by working with and alongside governments, multilaterals, civil society, and the private sector will we find the much needed solutions to these complex problems. And I noticed that this slide has popped up a little bit early, but for those of you who aren't aware, the IAPB Gender Equity Work Group, and Natasha, I'm also doing a plug for the work group that I chair, has developed an online gender equity toolkit. And I think that this slide gives you the URL, and I think it's being popped in the chat so that you'll be able to grab that from the chat box as well. One action that I want to take forward and explore with Natasha, who, as you know, co-chairs the IAPB Climate Action Work Group, is how we can increase the scope of this toolkit to consider the intersection of gender equity and climate change. So that's something, Natasha, that we will discuss further. Now, as we bring this event to a close, I am honoured to welcome Her Royal Highness, the Countess of Wessex, and invite her to offer reflections and make some closing remarks. Your Royal Highness, you have the floor.
Thank you very much, Jennifer. And if I can add all my thanks to all of the panelists and ambassadors and everybody else for being on the call today to witness this really important moment in the progression of how we tackle avoidable blindness in the world. I think actually, certainly from my experience of working in the field of vision, quite literally, is that when people come together, so much can be achieved because we know how to tackle so many of these avoidable blindness issues. We have the tools, we have the medications, we have the treatments, they are all there. And having seen how during my time with Queen Elizabeth Diamond Jubilee Trust Fund, how we've managed to get to a point in some of the sub-Saharan African countries such as Malawi of actually eliminating blinding trachoma, it can be done. And this is why being amongst all these amazing people today it's very heartening to see how the field of vision, eye agencies, organizations can come together and actually create this massive groundswell to be able to tackle these problems. And we can do it together, but it has got to be an enormous team effort. So we have the tools, we need the will, and I'm so happy that the UN resolution was passed, because I think it has been a seminal moment in this area to push this forward onto people's agendas. And I think today, again, is another moment in time, but I am really just here to encourage everybody to continue doing what you're doing and to change our words into actions. We know what the imperatives are. And as I say, we have so many of the solutions at our fingertips. And what we do know is that when we get it right, when we actually are able to tackle these avoidable blindness issues and to cure or avoid blindness, so many other health issues are tackled at the same time. We are managing to reduce the rates of infant mortality, maternal health, all sorts of things, diabetic issues as well. You know, it's not just one thing. Eyes are just the beginning, but we know that we can do so much more, but it takes a huge effort together. So I'm really just here to encourage all of you. And I certainly believe that, that the commercial world can play a huge influence in it. And thank you so much for your comments this morning, because I think if we can actually encourage and integrate eye health into corporate awareness, and for them to understand that actually so much more is won when you concentrate on eye health care as a starting point. So thank you for all of your comments. Thank you for the opportunity to listen to you today. As I say, we need to change our words into actions, and that's the most imperative thing. But there are so many people out there doing wonderful things. We just need to enable them to do more, because we can really make a world of difference to people. So I thank you, and it's been a delight to be with you all this morning.
Thank you, Your Royal Highness, and thank you for that call to action to work together. I'm sure it is well heeded. So that brings us to a close. Everyone, thanks everyone, especially to our hosts, the UN Friends of Vision co-chairs, and our two co-sponsors, UN Women and the World Health Organization. Thank you to all our speakers, the team at IAPB and at the Fred Hollows Foundation, and those behind the scenes at MYT. In particular to you, our audience, thank you for joining us today. I really do hope that you've enjoyed this stimulating discussion as much as I have. And I wish you a good day or good evening, wherever you may be in the world. Thank you very much, and goodbye.